Constipation after a hysterectomy is a really common problem that many women experience as a side effect of their hysterectomy. Fortunately, there are a number of ways that can help you stop constipation and avoid becoming constipated after your hysterectomy surgery. Hi, my name is Michelle, and I think constipation after hysterectomy is one of the most common problems that I've seen women experience after their hysterectomy. So today I thought I'd share with you 3 ways of overcoming constipated if you've already become constipated after your hysterectomy surgery, and also to how to avoid constipation. So we'll go through these 3 ways in turn, and particularly focusing on pain relief with this as well, and helping you to know how to get an effective bowel movement and empty your bowel without straining, because this is part of the issue. Constipation occurs because you've had the anaesthetic, there's pain relieving medications, also too there's swelling in the belly, and there's pain also too associated with the bowel movement. So we want to make sure that we're emptying the bowel effectively, and also too managing pain, not feeling uncomfortable during the bowel empty. So the first strategy that you need to use, and that many women start with using, is by taking an osmotic laxative. Now, this is something you need to check with your doctor, but the reason for this is it keeps the stool soft and also too keeps the stool moving through the body. So this is really imperative, and it's one of the first things that many women start immediately the day after their surgery. So osmotic laxative is really worth discussing with your doctor. It might be something like Osmolax or Movicol, and sometimes I even suggest women try this out before their surgery to know what their optimal dose is after surgery, particularly if you're already prone to constipation. So that's the first thing. The second thing is to move regularly. Now, lack of movement is one of the factors that contributes to constipation. So moving regularly as prescribed by your doctor or your physiotherapist is really important. Walking is one of the best exercises after a hysterectomy, and so your daily walking routine, often combined with a hot drink first thing in the morning, warm drink, and walking, can help to stimulate your bowel movements. Now, the third and most important thing that I want to go through today is the correct bowel movement technique for after a hysterectomy. Now, this technique involves a positioning and also a number of steps to empty the bowel without straining. In terms of the position is to sit down on the toilet to empty. So you always sit down, and I'll do some demonstrations here as we go along as well. So we're demonstrating the position. So this position is a lean forward. So I'll just come a little bit higher so you can see me. The position is a lean forward. So with the inward curve in your lower back, like that, lengthening the spine, lifting the chest, supporting your hands on your thighs or your elbows on your thighs. Now, this is really worth practicing before your hysterectomy so that you've got the technique going after the hysterectomy too. If you have had an abdominal surgery, an abdominal hysterectomy, you might want to be placing your hand over your belly during your movement. If you've had a vaginal hysterectomy, you might even find comfort in wrapping some toilet paper around your hand and using it over your perineum, which is the area between your vagina and anus, to support your pelvic floor during the emptying. Now, here's the technique. This technique is really important because it helps you to reduce pain during emptying and also to stop strain down through the pelvis as you're emptying. So really important technique. It's called the Mu de Poo, and I've gone through this in other videos, but it's really worth going through in this video as well for your hysterectomy recovery. Now, when you sit on the toilet, you start by taking some deep breaths in that position that I've already described. So deep breaths into your belly. If you've got maybe a towel wrapped up over your belly and your hand over that towel to support, can be helpful and comforting. Just something to support your belly if you have had your abdominal hysterectomy, and allowing you some support as you do your deep breaths, because your deep breaths are into the belly. So 3 or 4 deep breaths into the belly, and that actually helps to start to relax the pelvic floor and relax your core muscles. So those 3 or 4 deep breaths into the belly. Now, the pushing power or the pressure that we generate actually comes from making your waist wide, not pushing your bottom down, not pushing down through your pelvic floor. So when you start to empty, it's really important that you say sound means make your waist wide, and if you try that now, you'll feel your waist muscles wide. At the same time, when you say ooh, which means bulge your belly forward, ooh, as you bulge your belly forward, and again supporting if you need to, what you do is you open your anal sphincter. The ooh sound opens the anal sphincter to allow the bowel movement to pass and the stool to pass. So the combination is ooh, moo, and then if you need to press any more or generate any extra pressure, you say and then ooh again. So that is how you empty effectively. But it's really important that you have a soft stool to use that technique. It's not going to help you if you're already constipated. So if you are already constipated, really important that you speak to your doctor or your pharmacist straight away, and also to avoid overloading with fibre. Overloading with fibre is one of the most common mistakes that women make if they are already constipated, thinking that more fibre will actually help them. In fact, it won't. You're much better off going to lower fibre diet until you've actually moved the stool, and then picking up on your fibre again to keep your stool moving regularly. So we've talked about a number of ways of overcoming constipation and stopping constipation from occurring after hysterectomy. So I really hope this information helps you with your hysterectomy recovery to avoid constipation in the first place, but if it does occur, then you know how to deal with it if it happens. If you've got any comments or questions, I always read them, so please feel welcome to contact me, message me in the comments below. I always look forward to your comments, and I read all your comments too. Wish you all the best with your hysterectomy recovery. As always, if you've liked the video, I'd be really grateful if you could give it a like below, because then YouTube will be much more likely to share it with other women going through hysterectomy as well. Thanks so much for watching today. Really hope you've enjoyed the video, and I thank you for your time. Goodbye for now.